Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Last year's spike in measles outbreak isn't over yet. At the end of 2025, the CDC has reported 2,281 measles cases, and so far, in 2026, just under 1,000 have been diagnosed in less than 2 months. Last year, the highest concentrations of outbreak were in Texas and South Carolina. This year, South Carolina continues to bear the brunt of those cases, accounting for more than half of the outbreaks in 2026. Utah and Florida follow South Carolina, though not closely. Thankfully, no deaths have been accredited to measles in 2026 compared to 3 in 2025. All this data reflects the confirmed cases and does not include undiagnosed or unreported cases. As a healthcare community, we need to make education a priority for our patients. Providing every opportunity to learn about and receive vaccinations is vital, especially in rural areas where more at-risk populations exist. However, a significant factor in the low immunization rates is the federal policies that have created a new level of difficulty for public health systems fighting an infectious disease. The lack of guidance and the undoing of many essential national healthcare entities have left a gap in America's ability to fight back against measles outbreak. On to the damage report. Cutting healthcare services leaves care gaps that widen over time, putting vulnerable families at risk without access to the healthcare they desperately need. In Idaho, hospitals are seeing the effect of services cut in the worst possible way. After a healthcare organization eliminated their mental health service line at the end of November 2025, 3 patients who were previously using the program's mobile treatment have died of what healthcare leaders say were preventable causes, though specifics have not yet been announced. The support services closed in an effort to preserve the rest of the hospital as it struggled to meet budget requirements under the state's Medicaid program following a 4% cut to provider reimbursement. The mobile mental health teams that were serving patients were facing severe mental illness in those homes, provided an essential intervention for the 400 to 500 patients receiving services through the program. Of that population, about 200 are tied to a federal lawsuit in an attempt to stop the contractor from cutting these services. In rural communities, mental health care is one of the most at risk due to its reliance on Medicaid programs. As more cuts to reimbursement and coverages are made, we expect to see more closures like this, along with the ripple effect that carries for rural families. And now for today's success story. A faculty-led academic team from Mercer University School of Medicine and Engineering in Georgia have developed an inexpensive cricothyrotomy and chest tube trainers. These simulation devices are used to teach medical students and staff how to establish an airway in emergency scenarios. The goal of this project is not to replace high-end simulation devices that are already on the market, but to make employee training more accessible for rural healthcare systems. Thank you to our sources for this episode: Becker's Hospital Review, the U.S. Centers for Disease Control and Prevention, KFF Health News, and Mercer University.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.